That's great. Well, good afternoon, everyone. It's great to be back in beautiful Whitby, along with our municipal partners, Durham Region Chair John Henry, Whitby Mayor Don Mitchell, and Oshawa Mayor Dan Carter. I just took the GO train here with Minister Mulroney and Minister Surma, Minister Bethenfalvey, and PA Thanagaslam, and our local champions, Lorne Coe and Lindsay Park. And it's great. And it was a real great experience. I'll tell you, folks, it was clean, it was safe, it was reliable. It's a world-class commuter service. I want to recognize Phil Verster and Chair Metrolinx Chair Don Wright. He's another champion, Don. And I also have to thank Karen Cameron, the Ontario Public Transit Association, and the folks at the Canadian Urban Transit Association for their extraordinary work. Because the truth is, we're in good hands with our public transit agencies. They're working incredibly hard to make sure each and every rider has a safe experience, because many people rely on the essential service, and ensuring a safe public transit experience is even more important now that people are returning to work and our kids are returning to school. We worked around the clock with our municipal partners to keep transit going throughout the pandemic, because without transit, people can't get to work, they can't get to school. Without transit, our frontline workers can't get to the patients, workers can't get to the factories, or keep our grocery store shelves stocked. And we need transit riders and workers to have confidence that when they take GO train or a subway, streetcar, or bus, there are necessary safety measures in place, like mask requirements, like physical barriers, like hand sanitizing stations, like frequent cleaning of vehicles. Transit staff and riders need to know that they are safe taking transit. And that's why we've consulted with the Chief Medical Officer of Health, Dr. Williams, and the command table to deliver public health guidance for transit operators based on the best available medical advice and science to keep riders and transit staff safe. And that's why we fought for transit at the table with the federal government during the Safe Restart negotiations. We secured over $2 billion to keep transit systems running, $2 billion to enhance cleaning measures, help agencies purchase PPE for staff, and address fare shortfalls. And we've already announced the first round of funding to immediately support our municipal transit agencies as they prepare for more commuters in the fall. And we couldn't have done it without the support of our incredible municipal partners. My friends, everyone standing on this platform today, all the agencies across the province, we are making sure you and your family can get back to work and school safely on our public transit systems. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Mulroney.
Thank you, Premier. As Ontario gradually reopens, with kids returning to school and parents going back to work, our government is doing everything we can to protect commuters and families who are resuming the use of our public transit systems. With proper health and safety precautions taken by both passengers and transit operators, we are confident that people can feel safe on their daily commute. Everyone who uses a GO train, a subway, a bus, or a streetcar should feel safe and confident, which is why transit providers across Ontario are working hard to protect staff and passengers. We're working closely with Metrolinx to be a leader in public safety as they prepare to add more GO bus and train services beginning September 5th. Toute personne qui monte à bord d'un train GO, d'un autobus ou d'un tramway doit se sentir en confiance et en sécurité. C'est pourquoi les organismes de transport en commun de l'Ontario travaillent fort pour protéger le personnel et les passagers. Nous travaillons en étroite collaboration avec Metrolinx pour être un chef de file en matière de sécurité publique, alors que l'entreprise se prépare à ajouter des services d'autobus et de trains GO à partir du 5 septembre. Metrolinx has increased the frequency of deep cleaning at all work locations, stations, and vehicles, and have installed seat dividers on GO trains and buses. Hand sanitizer dispensers are being provided on every GO bus and at every GO Transit and Up Express station. Health and safety kiosks have been added at several GO stations to provide tools and advice on how to stay safe. And passengers can even choose to get their temperatures checked. We have also provided municipalities with $15 million in funding to support enhanced cleaning of their transit systems. Metrolinx a augmenté la fréquence des nettoyages en profondeur sur tous les lieux de travail, ainsi que dans les gares et les véhicules, et a installé des séparateurs de sièges dans les trains et les autobus GO. Des distributeurs de désinfectants pour les mains ont été installés dans chaque autobus GO et dans chaque gare du réseau de GO Transit et d'Up Express. Des kiosques de santé et de sécurité ont été ajoutés dans plusieurs gares GO afin de fournir les outils et des conseils de sécurité. Les passagers peuvent même choisir de faire vérifier leur température. These measures follow our government's comprehensive health and safety guidance for public transit systems released in June to help protect employees and passengers during the COVID-19 outbreak. And I'd like to remind everyone who will be using transit in the coming weeks to continue following public health advice and the requirements put in place by transit systems, such as practicing physical distancing, wearing face coverings, and washing your hands frequently. Together, we will continue to stop the spread of COVID-19 to protect the health and well-being of our communities as the province reopens and we return to work and to school. Merci, thank you. I'll now pass it over to Associate Minister of Transportation, Kinga Surma.
Thank you, Minister Mulroney. So much has changed this year, but our government's commitment to the health and well-being of the people of Ontario will never change. We know that a safe and convenient transit experience is critically important to individuals and families across the region and beyond. Whether it takes you to school or to work or to buy groceries, transit is an essential part of our daily lives. It takes cars off our roads to reduce congestion. It reduces greenhouse gas emissions. It connects people to places and opportunities. We are always working to make transit improvements, and we will not stop. Transit operators across Ontario are working hard to protect staff and passengers, and we're working closely with Metrolinx to be a leader in public safety. I am proud of the measures that Metrolinx is taking to keep Ontarians safe. Our government and the team at Metrolinx are making safety a priority, and we're reminding transit passengers to do your part to help protect each other. Don't take public transit if you're sick. Wear a face covering and wash your hands frequently. If you're unable to, use one of the many hand sanitizing stations available throughout your journey. By working together, we can make public transit a safe and convenient way to get around for everyone. And with that, I'll turn it over to Don Wright, the chair of the board of Metrolinx.
Thank you, Associate Minister Surma. It's a pleasure to be here today with you, the Premier, Minister Mulroney, and all the invited guests. I'd like to pick up on the point that you made about working together. Metrolinx has been focused on restoring and growing services to our customers. We are also continuing our program to build subways and new GO rail services safely. We very much prioritize working together with our regional partners. During the pandemic, we've collaborated with all the transit agencies across Ontario, including the TTC and Durham Region Transit, to jointly combat the pandemic. This includes sourcing personal protective equipment and supplies for all of our services and sharing safety best practices with our partners. Just this week, we worked with Durham Region Transit to launch Presto e-tickets, a new contactless fare payment option. We are also supporting Durham Region Transit to improve transit services to customers in this region. We have many joint projects, of which the extension of the Lakeshore East GO beyond Oshawa through to Bowmanville is the biggest and most impactful for both Metrolinx and the region. We already have a joint Metrolinx Durham team working on transit-oriented community investments at the proposed stations. We are also jointly developing the Durham Scarborough Bus Rapid Transit project. Metrolinx is privileged to be a part of providing transit solutions for Durham region. I thank you for having me here today, and it's now with great pleasure that I introduce an advocate for transit in Ontario, Karen Cameron, the CEO of the Ontario Public Transit Association. Karen?
Thank you. These have been trying times for public transit. When COVID arrived, we had to act fast to protect riders and to protect workers. We also had to keep operating. Even as ridership plummeted, essential workers in the health, grocery, and janitorial sectors needed to get to work. We relied on them, and they relied on transit. But there's someone else we came to rely on, the Government of Ontario. Throughout the pandemic, Minister Mulroney was in regular personal contact with transit agencies, and Premier Ford was a champion of including transit in the Safe Restart Agreement. Thanks to them and the federal government, public transit will receive up to $2 billion in support. Without this help, transit systems would be forced to reduce service. But because systems knew help was on the way, transit kept running, and running safely, in ways that didn't crowd vehicles, and with measures to keep drivers safe, such as shields, with service levels that don't make lower income workers, seniors, or people living with disabilities wait unacceptably long. From transit systems and our riders, our message to the government is simple and clear. Thank you. The speed with which you acted is appreciated. We couldn't have asked for a more committed champion, and we look forward to continuing to work with you as the finer points are worked out to keep transit moving safely. It's said often these are unprecedented times, but some things aren't unprecedented. Every day in communities across Ontario, people depend on public transit for essential trips, to get to work, to get groceries, to see doctors, families, and friends. Soon, they'll go back to school. And allowing people to do the usual in times that are anything but required helping public transit. Premier Ford and Minister Mulroney were there when we needed them, so we could be there when Ontarians needed us. Thank you. And with that, I'll now pass it over to Member of Provincial Parliament for Whitby, Lorne Coe.
Thank you, Karen. And as the MPP for Whitby, I'd like to thank the Premier, Ministers Mulroney and Surma, and the good people of Metrolinx for hosting today's event. My riding is home to many residents who rely on public transit every day to get to work and school. And the overwhelming message I heard today is transit is safe. Riders can be confident taking the train, bus, or subway, knowing that every step has been taken to put their health and safety first. I want to wish everyone in Whitby a safe return to work and a safe return to school. Thank you for joining us this afternoon.
We'll go to the phone line for questions. Just a reminder that it's one question and one follow-up, please.
Hi, how you doing?
Hi there, Same here.
Hi, Loretta.
On long-term care, you talked yesterday about the few new cases that we're seeing. Just to clarify, are any homes still being temporarily managed by hospitals? And also, what is your government looking at doing to ensure that those case numbers stay down heading into the fall?
Well, there are still a few long-term care homes managed by the hospitals. I think that's a good thing. I got to tell you, I'm a strong believer in something called campuses of care moving forward, that we have a hospital, and if they have extra property, even a stone's throw away from the hospital, that we start building the long-term care homes similar to what we've done here in Durham and over in Peel as well, and along with over by the 400 and Finch site. So it's really important that we keep the long-term care as close to the hospitals, and we're going to continue moving forward with the protocols and the guidelines that we've implemented in long-term care. And I just find it amazing. And it's, again, I want to stress, as nothing I did, the leadership through the minister and Minister Fullerton has done an incredible job. But most importantly, I know Minister Fullerton would agree with me, it's the PSWs. The PSWs and the docs and the people that manage a lot of these homes, they were able to, get control of it, and it was tough. But if you figure over 76,000 people that are living at long-term care, and one day we had 0, I think the other day is 1, I think today was 1. They deserve all the credit in the world. And by the way, those PSWs, They're overworked, they're underpaid, and I'm going to make sure we take care of that because they deserve more money. And this is, I always use them as comparisons. They went into an inferno. None of them complained. They went in there, they did their job. And I'm just so grateful for all the PSWs out there.
Follow up?
This one is from a colleague. We've recently seen some stores and restaurants temporarily shut down due to COVID-19 cases. How concerned should people be about going out to shop in places like malls? And also for you, how concerned do these closures make you?
Well, I'm concerned. My heart breaks for these small businesses. These people are struggling. You know, they're holding on by their fingernails, and we're doing everything we can to help them. And so is the federal government. We had a really good discussion with the Deputy Prime Minister the other day on how we could help these small business owners, and I think we're coming up with another plan to support them moving forward. But man, your heart has to break for these people. They're doing everything they can. And as for safety, practice the golden rules. You know, wear a face mask, wash your hands, and social distance. And that's what we have to do. My big concern are the numbers that I see every day from 20 to 39, and especially two areas. And I'm not knocking them because they're great. But when you're looking at Toronto and Peel, large populations, and again, it's not their fault. I want to stress that, but they're making up 60% of all cases in the entire province. That's concerning. So the people ages 20 to 39, the numbers are big there. That's concerning.
Next question.
Your next question comes from Tim Kelly with Durham Region Media. Please go ahead.
Hi, Jim. How are you doing?
Thank you. I wanted, there's been some concerns raised by small business owners in the Durham region that they raised with me about the end of the eviction ban that came at the end of August and beginning of September 1st. And I wondered that it came at the same time as the end of the secret plan for rent relief for owners of landlords who own these properties and small businesses rent out. I wondered if there's any plan to extend that eviction ban through to the end of the year, and any talks with the federal government about extending the secret plan.
Yes, yeah, good question. We did have that conversation with Christia the other day, how we can extend that. We can't do it alone. We need the federal government's support. So it's on the table right now. Our goal is to get everyone back on their feet so they can self-sustain themselves, their business, and move forward. But we're in discussions right now regarding that. We just have to help these people move forward. But not just that, too. There's like the banquet halls. These poor folks are hurting. And it doesn't apply for anyone with 50,000 square feet or over, and it's not their fault, you know, that they're over 50,000 square feet. So we're going to look at helping a lot of these banquet halls. There's a lot of them.
Follow up.
And also, people who are depending on the extension of the GO train service through the Bowmanville, they're wondering if things are going ahead as planned, and if everything's on course despite COVID-19 interfering with a lot of other things that are going on these days. Is everything going on as planned with the GO train extension to Bowmanville?
Yeah, so before I pass it over to Minister Mulroney, I just want to give a shout out to all the people at Metrolinx, all the frontline staff that have been through this pandemic. They're as solid as they come, and they're over there. So I want to thank all the great frontline people at Metrolinx. That's what makes these places run. Not me, not the minister, but the people that show up every single day. And I'll tell you, when I went on the train today, it was an incredible experience. It was clean. It was safe. I encourage people, hop on the train, take a ride, and you'll feel a lot more comfortable. I'll pass it over to Minister Mulroney.
Well, thank you for the question. Although the pandemic has had a great impact on all facets of our lives, it hasn't stopped us as we're moving forward with some of our important projects. As you know, Metrolinx has been working closely with Durham Region on the details of the Bowmanville GO extension, and so we're still proceeding as we had intended before the pandemic. And I would just like to thank the advocacy of MPP Lorne Coe, MPP Lindsay Park, and of course the President of the Treasury Board, Peter Bethenfall, they all from Durham Region, who have been advocating for the extension of the Bowmanville GO. So it is continuing as planned, and we'll have more to say about that in the future.
Next question.
Your next question comes from Natasha McDonald with Radio Canada. Please go ahead.
Hi, Natasha.
Hi, my first question is for the Premier. So the official opposition is asking us to review your back to school plan. So they're saying they're worried about the last classes, 70 kids on the bus. So I was wondering if your government would welcome a review by the Ombudsman and kind of just your general reaction to that.
Well, I got to share the experience I had when I went to the school yesterday, and again, the principal, I believe Mr. Fisher, he's incredible. Speaking of principals, I want to give a shout out. I was on an interview today, and when I got offline, the person interviewing me said, "Man, I went by the school and it made me feel so much more comfortable." It was Kate that was telling me this, and I said, "Who's the principal?" And they said, "Principal Stephanie Richards at St. John Paul II in Brooklyn, Ontario." And she said, after I left there, I felt so much more confident. And I'm not saying 2 million parents show up to the school, but I felt the same way. When I went through this school and I saw how the principal was so organized, because once we give them the tools, the principals are the commanders in chief, and they can, 99.99% of them are just incredible. They can make the difference. They can have the can-do attitude or the can attitude, and everyone I've talked to is the can-do attitude. They're excited. So it's a shout out to the great principal over at St. John Paul II School in Brooklyn. You're doing a great job. Thank you, Stephanie. You're making parents feel so much more comfortable. So they have every protocol in place. We've run through every issue we could possibly think of. We're putting everything in the kitchen sink in there. We're putting the 625 nurses. We're making sure that we have 1,300 more custodians. We gave $170 million to hire more teachers, more staff. We have $25 million for more PPE. The cleaning services on the buses, we're putting in $50 million into that. So it's just, we're pouring, give you an example, we're pouring $1.6 billion into just opening. Those are staggering figures. We do have the safest, most cautious plan in the entire country. And it's been vetted by everyone we could possibly think of. So we have a great plan. I encourage everyone to bring their kids to school. Very, very simple. We have a good plan.
Follow up.
My follow-up is for Minister Mulroney.
Yep.
Madame la ministre, j'aimerais vous entendre réagir en français par rapport au même sujet. Donc, est-ce que votre gouvernement accueillerait favorablement une enquête contre l'Ombudsman? Et en deuxième lieu, je suis curieuse en tant que ministre des Affaires francophones, quand et combien de fois est-ce que vous avez rencontré la FO pour discuter de leurs inquiétudes par rapport à la rentrée dans les écoles francophones?
Alors, j'ai pas très bien entendu la première question.
De réagir au NPD qui demande une enquête de l'Ombudsman.
Écoutez, notre gouvernement, sur les soins de longue durée? À quel sujet? De la rentrée scolaire?
Oui. Le NPD demande à l'Ombudsman d'enquêter sur votre plan, sur le plan de votre gouvernement pour la rentrée scolaire.
Okay. Alors, j'ai entendu. Okay. Alors, c'est à l'Ombudsman de prendre la décision indépendamment du gouvernement de s'il veut faire une enquête ou non. Et pour la deuxième question, je suis en contact de façon régulière avec l'AFO sur de nombreux dossiers depuis le début de la pandémie.
Next question.
Your next question comes from Antonella Artuso with the Toronto Sun. Please go ahead.
Hi, Antonella.
Thank you. Good afternoon, Premier. I wanted to ask as well about the back-to-school plan. A lot of parents are wondering what to think when your government says that schools are as safe as possible, but teacher unions are arguing you've created an unsafe working condition for their members. Why is this all still up in the air in September, and how are you going to make sure that parents' voices are heard in all of this?
Well, we consult with parents. We also consult with the teachers. Now, again, I've said this about the teachers union. I differentiate between the teachers union and the teachers. We have incredible teachers, and if you're asking me who am I going to listen to, some of the best doctors, health, mind, science in the entire country, or some head of some teachers union that wants to fight with every single government that God ever created. So, you know, they're playing politics. We're pulling out all the stops, and I have an idea. Why don't they try to help out? Why don't they pitch in? Why don't they be positive instead of painting a picture of apocalypse? The world's coming to an end. Why don't they jump in there like the great principals that I've talked to, the great teachers that apologize for their behavior to me every time I see a teacher? So all the teachers, I have all the confidence in the world. You guys are champions. I have confidence in the principal, and I'll listen to the docs and the health and science all day long, opposed to some head of the teachers union that has his degree in English literature, you know, as Harvey does. So I think the parents would rather us listen to the doctors opposed to some guy with you know, a degree in English literature, which thinks he's a doctor.
Follow up?
Thank you.
Thank you.
A lot of families, especially those with working parents, struggle to juggle everything during a regular school year. What is your expectation of employers in terms of accommodating their workers during the upcoming school year?
I always say, I was an employer before I got in politics. Be flexible, work with them. You know, these are the backbone of your company. It's not the ownership, it's not presidents or management. It's the frontline people that make the companies move. If you're flexible with them, they're going to be flexible with you. They'll come in and maybe work on a Saturday to make up the hours, or they'll be able to work at home. So work with them. We're all in this together. We're able to get through this together so far. And again, I want to tell you, we're leading North America in the lowest cases out of any large jurisdiction anywhere, and it's all because of the people, the 14.5 million people that are following the protocols and the guidelines from the chief medical officer and the health table. So everyone needs to work together, and we all have been. Everyone's doing a great job, and I'm very, very grateful for everyone's hard work and banding together, putting political stripes aside, and everyone's pulling in the same direction. So we're very, very grateful.
Last question?
Your final question comes from Colin Miller with CTV News. Please go ahead.
Hi, Colin.
Hi, Premier. Also on education. Recently, you've been highlighting the number of children 19 and under who have been catching the virus. And you said yesterday that it's inevitable that kids will catch it in school. I went back to August and looked at the numbers. There were actually 552 children 19 and under who tested positive for the virus. We don't know how many of them are school age versus university age, but 552 is still a significant number of young people catching the virus. I'm wondering what kind of impact do you think those numbers could have on schools?
Well, it's concerning. I've said, Colin, from day one, what I know, I want to pass it on. And I don't want to scare parents because there's 2 million kids, 19 of them, 2 days ago was 19 that had ended up with COVID. The other day, 20. It's back up to 20, so it's about 20. But to put it into perspective, 2 million kids, there's 20. I just want to make sure that when we go back to school, we're going to have the nurses in the high priority neighborhoods, and we're going to be ready. Because if I were to sit here, Colin, and say, oh, guess what? There's no cases. It's not reality. The reality is we have everyone prepared. We have Dr. Heyer prepared. We have public health prepared. Actually, it's on camera. When I went there yesterday, I just did a quiz right on camera. What happens? What are the procedures when we have one breakout? When do we have the procedures 2 breakouts? And I went to Dr. Heyer, went to Dr. Williams, went to the chair of the TDSB, went to the director of the TDSB, and they're well organized, really, really well organized. So we're going to do everything we can to make sure that we have the safest environment for our kids possible. But we do have to be realistic as well.
Follow up?
Thank you, Premier. You're right in saying that there's 20 today, but that's 19 yesterday. We're talking about daily infection numbers here. I'm wondering if there is an acceptable level of infection that you're comfortable with. I mean, you acknowledge that it's inevitable. I think a lot of people would agree with you. But what rate of infection in schools is unacceptable to you in the command table, so much so that it would require a revision in the plan?
Well, I'd rely on the chief medical officer, the command table, all the doctors that come up with a consensus. Again, I'll take direction from them, but we're zeroed in on this. We have our eyes on this every single day. The first numbers I want when I get briefed in the morning, how many kids under 19, how many seniors. But the other area that concerns me, Colin, are the numbers jumping from the ages 20 to 39. And it's amazing. Seniors listen more than younger people. It's very simple. Or maybe seniors stay at home and they self-isolate a little more. And I understand kids have to get out there and be with their friends. But guys, just be careful when you go back to school. No partying. Colleges and universities. I feel like a dad sitting there preaching to the kids, and I don't want to be that way, but it's critical. No parties when you go back to college and university. As I was talking to the doc yesterday, he said, yeah, kids are resilient. What happens when they come home and they bring it to their parents, old guys like me or the grandparents, or that's the concern. So we it's all hands on deck. We're ready. We have this one. We're ready.
All right. Thank you, everyone.
Thank you.